Good morning, everybody. Today we are going to see type 2 diabetes is completely reversible and diabetic complications are completely reversible. Blood sugars from 300 to 500 milligram per deciliter, HbA1c from 10 to 17%, reversed to 80 to 120 milligram per deciliter within weeks and maintained for months with minimum. Reversal of type 2 diabetes, it is possible now in 2020 with the available latest insulins and newer anti-diabetic drugs. Traditionally, it is believed that diabetes is a progressive disease. The internationally famous landmark trial UKPDS showed us that diabetes is a progressive disease and eventually patients will need more and more drugs and then insulin may be needed. However, this trial was done between 1977 to 1997 and we have come a long way since. We now have much better drugs than the ones they used back then. We now have drugs which can completely reverse diabetes. Conventionally, it is believed that at the time of diagnosing type 2 diabetes, 50% beta cell function is lost. And for the fasting blood sugar to go above 200 mg per deciliter, more than 80% beta cell function would have been lost. If you see this graph, it shows that the beta cell mass at the time of diagnosis drops by 50% and beta cell function also drops by 50%. And from normal glucose tolerance, patients susceptible beta cells go in for beta cell dysfunction or hypofunction, and at the time of type 2 diabetes, beta cell mass is lowered by 60%. And similarly, in this graph, you can see during the various stages of diabetes, at diagnosis, the beta cell function is only 50% available there. And the UKPDS also showed a progressive deterioration in beta cell function over time. At diagnosis, the beta cell function is only 50% and eventually it keeps on dropping. We are now presenting patients who came to us with fasting blood sugars of around 250 to 400 mg per deciliter and postprandial blood sugars around 300 to 600 milligram per deciliter and HbA1c of 12 to 17%. Within a few weeks, all these patients had excellent blood sugar control and slowly all their medications are withdrawn one by one during subsequent visits, and now they are all maintaining excellent control with minimum drugs for months together. This is a 44-year-old lady who came on 4th August 2020 with a fasting blood sugar of 388 and a postprandial blood sugar of 478 milligram per deciliter. She came on 4th August 2020 and within 3 weeks on 26th August 2020, her fasting blood sugar came down to 99 mg per deciliter and postprandial blood sugar came down to 126 mg per deciliter. Similarly, a 38-year-old female came on 25th July 2020 with a fasting of 260 mg per deciliter and a postprandial of 441 mg per deciliter on 25/7/2020. Within 6 weeks, her fasting blood sugar came down to 82 mg per deciliter and postprandial came down to 140 mg. And a 67-year-old with a Subbalakshmi came with a fasting blood sugar of 248 mg per deciliter and a postprandial blood sugar of 457 mg per deciliter on 27th of July. Within 9 days, her blood sugar came down to 119 fasting and 235. And this is another patient with the 42-year-old male came with a fasting blood sugar of 294 mg per deciliter and ppbs of 344 mg with HbA1c of 12.90 on 25th January 20. Within 11 days, his blood sugar came down to fasting 89 and ppbs 169 mg per deciliter. After another 17 days, it came down to fasting 83 and ppbs 96 mg per deciliter. Now his insulin was stopped, his medicines were ready. After 6 months, still his blood sugar is under excellent control with a fasting of 97 mg per deciliter and a postprandial of 109 mg per deciliter. He is now not on insulin, he is not on sulfonylureas, he is only on metformin to prevent the progression. You can see his values after 6 months. Fasting is 97, postprandial is 109 on 25th August. So, excellent control of blood sugar at diagnosis with the latest drugs and insulin use can reverse diabetes completely and help you manage with minimum drugs to come. Any drug will reduce the blood sugar in the drug naive newly detected diabetic patients. But what drug you use and how you handle the early stages decides the future course of the disease and complications. Whenever there is glucotoxicity, there is beta cell stunning. And when you reverse glucotoxicity, you can reverse beta cell function and reverse diabetes. So they have reversed type 2 diabetes in hundreds of patients with this strategy. For any further clarifications on our strategy, you can call us in the following numbers or you can email us at drlm26@yahoo.co.in or you can log into our Facebook page or YouTube. Everything we have discussed here is well known to all endocrinologists, diabetologists and physicians in Chennai. They follow the strategy every day for hundreds of patients. Our aim is to disseminate this knowledge around the globe to all healthcare providers treating diabetes to help us win the war against diabetes. This article is written primarily for the primary care physicians and general practitioners. We have given the list of references here. For those of you who are interested, you can log into these references for further reference. Some more interesting cases with very high blood sugar values where we have utilized the same strategy is shown below. The patient who came with 324 fasting and 598 pp. And similarly, another patient who came with fasting 298 and pp 404, HbA1c 1%. And this patient came with 484 fasting and 557 pp. And another patient who came with 357 fasting and 500 pp. And this is another patient, 43-year-old Sandil Kumaran, came with 308 fasting and 458 pp. And this is another 45-year-old lady, 45-year-old male, Mr. Raji, who came with fasting 331 and postprandial 420. And this is 33-year-old Mr. Kandiyappa, came with fasting 270 and postprandial 406. And this is Mrs. 52-year-old Malika, who came with fasting 300 and postprandial 416. So we have got hundreds of patients like this. We have shared a few patients for your reference. The points to note here are, if the patient is very sick, admit immediately and start IV insulin. And always check the urine ketones, ABG, ECG, renal parameters, serum electrolytes for patients presenting with very high blood sugar levels. If there is any suspicion of DKA or harm, admit and manage. If you have any doubts, refer to an experienced physician or endocrinologist.